Hi guys, welcome to our YouTube channel. So in today's video, we'll be looking at ascending cholangitis. But before that, let's look at the question from our previous video. So this was the question: which of these is not a part of Charcot's triad? And A is abdominal pain, B is headache, C is fever, and then D is jaundice. So the correct answer is headache. Headache is not part of Charcot's triad. Charcot's triad is made up of abdominal pain, which is a right upper quadrant pain, fever, and jaundice. And if you want to know more about this, then continue watching this video. So let's begin. Ascending cholangitis. Cholange means bile duct and the suffix itis means inflammation. So the basic definition you can give for cholangitis is inflammation of the bile duct. And this inflammation is as a result of bacterial infection. So these bacteria are normally found in the intestine and they make their way up the bile duct from the duodenum, and because they are going up the bile duct, it's known as ascending cholangitis. It's also known as acute cholangitis because it can occur within a short period of time. Normally, there are some defense mechanisms which protect the biliary system from infection, and one of them is the continuous normal flow of bile down from the gallbladder into the duodenum, and this keeps intraductal pressure low and also flushes out any bacteria that is trying to make its way up the bile duct, and this prevents bacterial concentration. Normally, it won't be easy for bacteria to ascend the bile duct because they'll be flushed out. But the problem in ascending cholangitis is that this normal flow of bile is blocked, and this is due to the presence of gallstones in the common bile duct. And the medical term for this is choledocholithiasis. Let's briefly discuss the anatomy of the biliary system for a better understanding. So bile is produced by the hepatocytes of the liver, and it's carried by the right and left hepatic duct from the right and left lobes of the liver respectively. So now from the diagram we can see that the right and left hepatic ducts join together to form the common hepatic duct. And we can also see the gallbladder, which is this hollow pear-shaped organ that lies in the gallbladder fossa on the inferior surface of the liver in the right upper quadrant of the abdomen. Its function is to store and concentrate the bile that is made by the liver. It drains bile into the duodenum through the common bile duct, aiding in fat emulsification. The gallbladder has three main parts: the fundus, the body, and then the neck. And as we can see from the diagram, the neck of the gallbladder is continuous with the cystic duct. The cystic duct joins together with the common hepatic duct to form the common bile duct. And the common bile duct passes posterior to the duodenum and pancreas to unite with the main pancreatic duct to form the ampulla ovata, which is also known as the hepatopancreatic ampulla. This ampulla opens into the major duodenal papilla, into the second part of the duodenum, and between the ampulla and the duodenum there is the sphincter of smooth muscle, which is known as the sphincter of Oddi, and its function is to regulate the flow of bile and pancreatic juice into the intestine. So it's a valve that opens and closes. Normally it's closed, but it opens in response to a meal so that bile and pancreatic juice can enter the duodenum and mix with the food for digestion. So now that we understand the anatomy of the biliary system, let's continue talking about ascending cholangitis. As I already mentioned, normally it's not easy for bacteria from the intestine to ascend up the bile duct because they will be flushed out by bile that is flowing down from the gallbladder through the common bile duct into the duodenum. But the problem here is that this normal flow of bile is blocked. And this is due to the presence of gallstones in the common bile duct. So these stones form in the gallbladder, slip out and travel through the cystic duct and then get stuck in the common bile duct. And this blocks the flow of bile. Some risk factors for the development of these stones include being female, being over the age of 40, being overweight or fat, and then being fertile, that is being pregnant. So we can remember these with 4 F's: female, 40, fat, and then fertile. If the stone continues to remain in the duct, bacteria can eventually make their way up the duct and cause infection. And some bacteria that can cause this infection include E. coli, Klebsiella species, and then Enterococcus species. So now we know that it can be caused by obstruction due to the formation of gallstones in the common bile duct, and as a result, bacteria ascends from the duodenum into the bile duct to cause infection. It can also be caused by anything that causes a stricture. So a stricture is an abnormal narrowing of a body passage, in this case the abnormal narrowing of the bile duct, and this narrowing can occur when a nearby tumor enlarges and compresses the duct, and in this way keeps narrowing it. Now the next thing we'll look at is the signs and symptoms, and this is where we'll talk about Charcot's triad. So it's a group of 3 symptoms. It's made up of fever, right upper quadrant pain, and then jaundice. Now let's talk about jaundice. So jaundice is the yellowing of the skin and the white of the eyes, that is the sclera of the eyes, and this is due to hyperbilirubinemia. Hyperbilirubinemia means high levels of bilirubin in the blood, and this happens because of obstruction due to the formation of stones in the common bile duct. So normally the liver takes bilirubin from the blood, conjugates it and releases it. The bilirubin goes through the common bile duct and into the small intestine where it's excreted later. But because the common bile duct is blocked, this conjugated bilirubin can no longer go through the common bile duct, get into the small intestine for it to be excreted, so it tends to build up in the blood and start to cause yellowing of the skin and sclera of the eyes. So in this case, it's an obstructive or mechanical jaundice. Also, due to the obstruction, bile is not able to flow as it should, so it becomes stagnant in the biliary system, and this increases intraductal pressure. Now, this increase in intraductal pressure causes the tight junctions between the cholangiocytes to widen. So the cholangiocytes are the cells that line the bile ducts, and when this happens, it allows bile and bacteria to enter the bloodstream. When the bacteria gets into the bloodstream, it can lead to septic shock, where the blood vessels become leaky and eventually lead to hypotension. Hypotension can in turn lead to a decreased blood flow to the brain, and this can lead to an altered mental status. And in this case, you can have reynold pentad. So a pentad is a combination of 5. So it's the combination of Charcot's triad, hypotension, and then an altered mental status. Some other findings include pruritus, which is an itching sensation, and it is due to retention of bile salts. There can also be nausea and vomiting, dark urine, clay-colored stools, rigors, and then tachycardia. Now about the diagnosis. Some imaging techniques like ultrasound scanning and ERCP, which is endoscopic retrograde cholangiopancreatography, can be done. So on ultrasound, it will show dilated bile ducts, and ERCP will help to visualize any obstruction in the bile ducts on an X-ray. Also, laboratory investigations need to be done. So with the labs, there would be leukocytosis because it's an inflammation, and also there would be an increased C-reactive protein level, an increased ALP level, and also a deranged liver function test. Finally, let's talk about the treatment. So treatment is based on managing the symptoms, and this can be done by offering IV fluid resuscitation, giving analgesics, and starting antibiotics. Also, for definitive treatment, ERCP can be used. So not only can ERCP help to visualize any obstruction or blockages in the bile duct, it can actually remove the stones. So it serves as a diagnostic and then a therapeutic procedure. So that brings us to the end of the video. But before you go, I'll give you an MCQ to try. So here is the question. Formation of stones in the gallbladder is known as A. Cholangitis, B. Choledocholithiasis, C. Cholangitis, and D. Cholelithiasis. So what do you think the correct answer is? You can leave your answers in the comment section and we'll discuss it in our next video. And if this was helpful, kindly give it a thumbs up, share, subscribe, and also turn on your post notification bell so you don't miss any video we upload, and we'll be back with more videos.